Hello everyone, we're back again with yet another guest. Today I have Dr. Siddhartha with me, and you all would be really enlightened to know that he is in UK, he's in London, and he's pursuing his medical career now there. So I would actually welcome Dr. Siddhartha and like him to give us an introduction of himself.
Hello everyone, and thank you Laveena to host me here today. So I'm Siddharth Murekar. I am a international medical graduate from India, Maharashtra. Currently at my I am working as a clinical fellow in trauma and orthopedics in King's College Hospital, London. And this is my first NHS job. I've cleared my PLAB exams, and we will talk more about it later. So I've cleared my PLAB. I have a GMC registration now, and yes, that's enough for introduction.
So I would actually like to know, how did your journey of medicine or medical career start from when you were back in your high school, or when you just graduated from your high school, you were preparing for your NEET UG?
So at my time there was no NEET. Okay, there was this 720 scoring called of MHCT. So I'm not too old. Okay, by the way, I'm just 20. In 2014, I started my med school. I did my med school from a private medical college in Jalgaon, Maharashtra. So those of you who ask me many a times on DMs, can a person from a private can go to and work in London or something? So it's obviously possible. There's nothing called a private or government at one stage of life. So I did my med school from there from 2014 to 2020. I graduated in around March 2020, and thanks to COVID, I then actually during the last days of my internship, this was kind of an inception from somewhere that I was preparing for NEET PG. I had prepared well for the NEET PG as well. I got good score in the first attempt, but then I thought, why not PLAB? It all started with why not PLAB rather than why PLAB actually, and slowly I transformed from why not to why I have to go for PLAB in this journey. So this is regarding my med school. So yeah.
Okay. So as you said, the journey of your PLAB 1, PLAB 2, going to London, all of that started at the end of your internship, right? So how was your PLAB 1 and how was your PLAB 2?
Yeah, so this is the very specifically you mentioned that about the end of internship, because the people who text me, they are in first years. Some are like in 12th standard, they text me about sir हमको UK में पढ़ना है types. Okay, so थोड़ा slowly ले लो, it's fine. Okay, there's no race actually. That's a good thing. At some stage, at this stage, there is no race actually now. It's more about you. So even if you are in first year, second year, third year, final year, as Laveena is in final year now, and fourth year, I don't know, like 6 years is it? So
It's
you are
6
in
years. I still have a year to go.
year to go. Okay, so it's not late in the first place. You can go for this exam. This is a licensure exam in this stage. So I'm little bit specific with the dates because all this thing happened to me within the 1 year span. So I feel really lucky to go through this journey so quickly. I know there are delays and all this nowadays, and there are people who I know who have been waiting since 2 years. So practically, I graduated in 2020. I sat at home. I did some homework for 2 to 3 months time. Sitting at home in COVID, this was the best thing actually. And then I started my job in June 2020. And in November, I gave my OAT because until that time, OAT centers were closed due to COVID. So I am from Nagpur, originally in Maharashtra. Then I had to travel to Hyderabad to give my basic English exam, English proficiency test. And after that, the results came and I realized, oh my God, there are no seats for PLAB 1, as everybody feels that way. So many people still feel that I'm lying, okay, because I got my very much friend, they say, ye ho hi nahi sakta type. So literally after I passed OAT and I opened the GMC account, first day actually I saw the screen was blank actually, the PLAB seat kind of thing. And I was like, yeah, where are the seats, man? I think so there should be some seats. So I was so noob in this. So I emailed GMC कि यार seat कहाँ पे है, कहाँ से book करना पड़ता है type. So they are like, the creepy kind of look, I think so they must have given to, because there are no seats available. That's why you can't see the seats. So at 2020 December, this PLAB thing and all this, there were not so much information on the internet, not that it is now, there are not people among us who have done this journey in 2020. So you can understand how difficult it was at that time. So I gave my PLAB 1 in 2021 February. Thanks to cancellation seats, I was online refreshing the page many times, and PLAB 1 in 2020. And again, thanks to second wave of COVID, I couldn't give my PLAB 2 immediately. So I thought, fine, I'll resign from my job in May. I worked for around 11 months in a civil hospital, kind of. And then I thought I should give a MRCS Part A. So I gave a MRCS Part A in September 2021. And luckily I cleared it. And then I got again a cancellation seat for PLAB 2 in December 2021. Thanks to my 6 hours of everyday online refreshing the page, I got you'll still feel really weird, but I got my seat like 1:50 a.m. in the morning because just refreshing, and luckily there was this seat. I took the seat because I know there was no second option for me in the So I took the seat within a span of 2 months time, and I had no visa, nothing, and everything. So I did my PLAB 2 on December 3rd. I gave my exam. Sorry, December 2nd. And last week of December, I got the results. And yeah, luckily I passed. And I applied for GMC. I started during this after PLAB 2. I started my clinical attachments in very good hospitals, I feel. Queen Elizabeth Hospital, Birmingham in neurosurgery, 1 month. And during that time, I also got a attachment in King's in general surgery and trauma and orthopedics. So during these attachments, I got the results. I got GMC, and I had my back ticket booked on 20th Feb. 11th Feb was my last day of my attachment, and 10th Feb actually I had an interview and all these things from 2 other trusts and Kings as well. And I got the job before going home. So I went home. Yeah,
that is fantastic, going home with a job in hand.
Yeah, so sorry for this elaborate description, but I thought I should just sum up whatever happened to me this 1 year span.
I actually wanted to ask stuff in detail now. Okay,
Yeah.
So question number 1, when does a person or a student start to prepare for PLAB 1? In the starting of the internship, before internship, when? And when do we apply for, because seats get full really easily?
Yeah. So I've been recently updating with the recent norms, what is happening with the GMC. So they have actually started giving seats for next year now. This is the general prediction. Once you graduate your final year, so practically you have a provisional degree, you can say, or you have the degree. But in India, they don't give you degree unless you complete the internship. But practically, you can sit for PLAB after you pass your final year. Okay. So criteria wise, you can sit for PLAB after your final year. Okay, PLAB 1. But before PLAB 1, you have to clear an English proficiency test, that is IELTS, if you guys know it, and there's OET, which I gave it. So these exams, you don't need much preparation, maybe a month or 2 of preparation. And I think so, if you are in final year now, for example, try to plan up that in the final year you give OET and you book for a PLAB 1 seat. You will get a PLAB 1 seat maybe at the end of your internship, just a month after the end of your internship. And once you give that, and fingers crossed, all the best, and you pass it, and you can then you can search for the PLAB 2 seat. So generally it will take another 4 to 5 months. You can work during that time if possible, and you can go for PLAB 2.
Right. So you spoke about attachments, right? Since we compare. I don't want to compare, but this is what happens. Most students in their heads, they compare USMLE and PLAB. So for USMLE, you definitely need your electives. That is your attachment, as we say it for UK. So you need your electives, you need your LORs, you need your resume to be really good. You need your volunteering activities and stuff like that. Yeah. So is this are these like norms required for your PLAB as well? I mean, is attachment important? Is doing volunteering work important? Is all of these resume building things important for UK as well?
So this is very, very peculiar and nice question. So I like to answer this in 2 formats. So practically there are 2 criteria whenever you go for any interviews in UK. One is desirable criteria, and one is mandatory criteria. Okay, so other way around, mandatory criteria is you will need to have a MBBS degree to even apply for PLAB. So this is mandatory. There is no option for that. You need PLAB 1, you need PLAB 2 for getting a GMC registration. These are mandatory criteria. So other things, as you mentioned, so for getting into residency, yes, you need a mandatory CV, for example, or getting a job. Practically, on paper, once you actually clear PLAB 2, you are eligible to get a job in UK in the first place. But everybody is cleared PLAB 2, right? For example, out of 10 people who have cleared PLAB 2, 10 will apply for the jobs. Then comes the question of, okay, fine, what Laveena has extra in this. So okay, she has maybe this attachment, she has some MRCS, she has some MRCP, or any example. Fine, she knows the NHS system little better than other people by a month or two at least. So at my stage, I can say that, for example, there are 10 people in the room with me. The people who shortlist for the interviews, I have spoken to a consultant regarding it as well when I was working. So I was like, uh, I was really naive, I can say. I directly went to him and I was like, do you even read my CV when you selected me, or you just like, and he was like, frankly, I didn't obviously go through your CV much. Okay, it was like, I just saw, okay, you are a PLAB 2 pass, okay, you got MRCS, okay, fine. Apart from that, I don't actually care at your stage about what you do. So practically these things about your work and your experience and all this do matter, but they do matter at higher stages when when you apply for registrarship or when you apply for consultant jobs. At my stage, if I have MRCS, they are happy with me. More than MRCS, for example, if I have NHS experience, for example, I had for 2 months of NHS experience, they feel that this candidate will adjust in the system 2 months prior to other candidates. So it will save 2 months of the recruitment process, 2 months of everything. So this is what my answer will be for your question. So it's not a mandatory thing, but in now the things are quite competitive, at this stage, because people know Laveena, and there are people like 6 feet surgeon like me who are talking about it. It was not the norm 2 years ago. So if more people are talking about it, it means more people know. If more people know, more people will work on it. So this is the thing.
Right. So tell us a little about your preparation for PLAB. I mean, the resources that you've used for PLAB 1 and separately for PLAB 2, because I've heard there are some, I think, sessions, or there are some courses that you can enroll yourself for PLAB 2, right? Back in UK. So just give us a brief, just throw some light on that aspect.
Yeah. So PLAB 1, I told you my story. I was actually started preparing for PLAB 1 in mid 2020, I can say, after I started my job. I didn't have the English exam in my hand, but I was like, today or tomorrow the exam will come and I'll clear it and I have to go for PLAB 1. So this is where I'll have to, publicize my things. Okay. So sorry if you got anyone doesn't like it. So PLAB 1, I've started actually shipping my notes and all this. So I prepared my own notes. I used multiple guidelines as well while preparing them, especially the common ones are the question banks and the keys and everything, that is required for basic PLAB 1 orientation. And, there is no limit to medical knowledge. But when I was preparing, I realized there has to be a limit to what you learn, because there can't be a limit to what you know. So I started preparing for PLAB 1 by making my own notes, which now are called as handwritten PLAB 1 notes by Siddhartha. You can check them out if Laveena post my Instagram list. So I prepared from my notes and Q bank. So you can take any Q bank in the market, Med Revisions, PLABable. I chose PLABable. I worked for PLABable as a volunteer as well. So in my I used to do a lot of extra things. I just like doing it, nothing else. And for PLAB 2, again, I got a cancellation seat, right? So I was kind of, just tell me what is needed to pass. I don't want to, rest medicine I will learn when I'm in the UK. Just tell me what need it's to pass, okay? So this is my mantra. You don't have to do PhD in PLAB 2. You have to pass PLAB 2 in the first place. Okay, so I joined Aspire. Frankly, all academies are similar. Some have good mocks, for example, Samson. Some have good teacher skills. Some, for example, Aspire. Anything. Swami, Mo Showbiz also famous. There are multiple things. All depends on how you practice and how much you practice. So I used to practice a lot with different peoples. I had two constant partners with other different people who I have to just practice randomly. So main thing is practice. Once you know a little bit of the script, then it's all on practice. This
Right.
is for PLAB 1 and PLAB 2. Yeah.
So after getting your PLAB 2, you passed, you have your resume ready, you have your PLAB 1 results. Now, how much time do you have to wait to actually get into college, get into residency and work? What is that time span? Because many people, I've heard that the people that I've talked to, they say that it takes almost 3 to 4 months, or it might even take 6 months to, wait and match to with a hospital.
Yeah. So this is again one of the questions wherein there is no specific answer for it. Okay. Uh, I got my job 10 days after getting my GMC registration, practically. So if I say everyone will get it, then I'm wrong. And nobody will get it within 3 months is also wrong. So I have friends who are waiting for few months now. Many people who have been waiting for 4 months, 5 months, example. And I have friends who got within 2 months. There are people who wait for 8 months or something. It all depends on, firstly, CV. Okay, now we can talk straight. Firstly, depends on a CV. Okay, second thing, it depends on how aggressive you are in your approach. So frankly, personally speaking, I am a person who is quite impatient in doing things. So I don't like to wait because I feel it's wasting my time. So some people are little bit relaxed in their applications, kind of thing. you know I used to apply randomly to everything, actually. I didn't even know what jobs I've applied for. And so this is the thing. So CV, your in general approach to how you go for applications, you have to be very aggressive because there are lots of fishes in the sea who needs to be picked up. Yeah.
Right.
Yeah. General time 3 to 4 months, you can say that. Yeah. Sorry, you're saying something.
Yeah. So you got into trauma and orthopedics in the starting, right? So how has trauma and orthopedics been for you? And also, I would like to ask one more question. If I do not want trauma and orthopedics, I want to go into solely just surgery and I want to learn, just general surgery and then go forward being a surgeon. So
Mm.
is it better to wait for, getting matched into a particular surgery field, or is it better to just start off?
Yeah. So firstly, matching is not the concept in UK. This is
Yeah.
in the USMLE concept. So
Right.
you get a job and then you get a training number. So this is the first non-training kind of job for me. It can be anything practically. I have people in my department who want to do medicine and they are working in trauma orthopedics. So if you want to do general surgery, don't try to be too choosy in the start. First job, practically take whatever you get in this scenario. I was little adamant that I needed to start in a surgical job only. I didn't want to do medicinal job in the first place. So start any specialty. It's always good to get into specialty which you like, and then you can start building on your portfolio. Like I'm working on my portfolio now, and then you can apply for the training. This is the general norm. Yeah.
So, how has it been working there with the people, the ambience around, and obviously, how is it? How is the environment there? How is it treating you?
Yeah. So personally, I was and I am quite obsessed with King's College. Okay. I had this obsession, right? I had to work there. It was one of my obsession. You can't justify your obsession. This is one of my obsession, that I have to be there. I have to be in that environment. I have to be in the people who are working there. Till now, it's very early to even comment on such things, but till now it has been amazing. My, what you can say, rotas are amazing. I have specific training days in my rota. The department is super amazing. They are roping in me for research projects and audits and everything. The consultants are super friendly because I'm quite young for them, so they feel that he's that young chap with passion and fire, kind of thing. So they actually been quite supportive to me. And there are nice courses that are being run at specifically King's, that the overseas development program we had just recently. All the doctors who have just joined, they just sit and talk, tell their issues, how about the journey. And there's a medical director who is sitting in front of you, and he discusses his side. And there are some nice courses going on. Nice thing. People are quite friendly. My registrar is a Ben is one of my registrars, so everything is quite good at this stage, I can say.
Right. So you never thought about giving USMLE and going to US rather than UK?
So quite offensive question. So maybe I'm quite what you can say. I did less homework in USMLE part. First thing is what I don't know. You guys can cancel me. You can drop a comment. No, no, this is not like that. What you say, Siddharth. So you don't get surgery in US. This was the norm I had. Bluntly, I'm speaking, and I can't go to a country which is not at all giving me surgery. Okay, so I may like medicine or pediatrics or pathology in UK, but that is what I will choose. This concept of people choosing what I will get, I'm not. I want control over what I do in life. So if I'm not, they're not giving me surgery. Thank you so much. I'll do NEET PG or I'll do PLAB. That was my thing.
Right. So I'm sure it didn't take much time for you to adjust in the environment of UK. As you said, it was so amazing and, inviting, right? And what about the
Uh,
food there?
yeah. So adjustment is that I like to tell Laveena. So the stage I am in, I just graduated. I have started working. So practically, I don't have much egos at this stage. I don't have any surgical practice. I don't have my technique of doing surgeries. So I'm like a whiteboard at this time. I say, throw any colors on me. I will take the color and I'll paint a picture of it. So that has been a good and very positive aspect of my side, that I'm liking it because I don't have any issues. They are giving me the best. I'm taking the best. Food, I cook my own food. Okay, you can try any of the dishes I cook. Sometimes you can check on my Insta story what I'm cooking. And food has been good. You get everything. Okay, dude, it's globalization, right? You get anything, everything. I'm getting to buy some cooker and all tomorrow morning. So doesn't matter. I have all masalas stacked up in my drawers. So yeah, it's good. Food and all
Right.
is not an issue.
So as you spoke about OET and IELTS, so people say it's very easy to give. You just have to go through the basics. हो जाएगा. मैं तो pro हूँ English में and stuff. Do you actually have to sit and prepare? Rather it be through YouTube, but sit and prepare for OET or IELTS.
Uh, so you can rate me as a dumb person now, because I had so much time actually, because exams were not happening, and the only thing I can do was I could practice. So OET is not a difficult exam in the first place. I will obviously boast for OET for all the medical graduates. Okay, people always dice this question. I like to speak to their face. Just give OET, frankly. Don't try to be. If you are comfortable with your English proficiency, okay, but not many people are. And being comfortable means getting the grades. Okay, being comfortable is not watching some movies. Okay, yeah. So I practice. I wrote some letters. I got a speaking partner and all this for OET. I don't know. It may be different for different people, but मुझे कोई कमी नहीं रखनी थी, because I had this one option. So I practiced a lot. I read 40, 50 odd letters. So this is too much. People write 4 or 5. I wrote 40 letters just to practice myself and be the best in the first attempt. So just practice on the sample test. IELTS has their resources. IELTS Laser. OET has their official sample papers. Just practice out and then decide कि मुझे ज़रूरत है कि नहीं. I think so.
Okay, so apart from English, वहाँ पे कोई ऐसी local language चलती है that you're supposed to, maybe थोड़ा सा if you learn you'll be better with locals. Like back in US, I think it's Spanish that is locally, people really, boost the use of Spanish. So is there any local language like that back in UK?
So UK is multiple countries kind of thing. So England doesn't need any other language, but you are in Edinburgh, Scotland, then Wales. It's Welsh is one of the language. It's good to have, because I filled some applications for Wales as well. So their first question was, do you know Wales? Do you know Welsh actually? So it's always better to get the local language. But in England, practically you can survive without a second language. But it's always be mixing in the people and the society more than actually dealing with the patient. So in England, you don't need any other language. In Wales, Scotland, it's good to have another language with you.
So, talking about research work, research work is actually sort of boosted these days because everyone is like research work करना है, resume में डालना है, कुछ तो research का करना है ताकि seat मिल जाए या admission हो जाए कहीं. So for UK, is research work kept at a higher position कि हाँ अच्छा से research किया है, and he's there in some publications, so we'll keep him at a higher position and probably take him in our hospital.
So again, this is a blunt. This is not a. This is one of the desirable criteria while getting a job. Okay.
Right.
And obviously, when you try to enter training and when you try to enter ST3 levels, like specialty registrar level 3, then it becomes a different thing. So then the research matters. At our stage, for example, going with the PLABs and all, research, more important than research is the audit this country loves. It's more about the systems, improving the system that are already in place rather than finding new systems.
So we were talking about how PLAB is changing its exam and turning it into UKMLE. Now UKMLE is an exam that is what is thrown forward in front of our faces, that common exam hoga for locals as well as for the people who are coming from outside. So what is your take on this, or is this exam actually happening? Is this change happening? Throw a light on this thing.
Yeah. So UKMLE on this actually. So they have United Kingdom Medical License Authority, UKMLE. So they are trying to merge it. So practically, unless it is in the market, you can't actually comment on that, I feel. Okay, because many things people say about next PG, for example, next. So until start next and all this, then only you can comment on it. So it's a good thing that travel, if they are trying to merge it, I am not very sure about how they are going to do it. But if the people who don't have to travel to UK to give PLAB 2, or they try to do something at one go, I'm really unsure at this stage about what are the steps they are planning on it. But if they are planning to merge it in one exam, I will obviously prefer it giving, because waiting for PLAB 1, if you fail PLAB 1, then waiting for you don't know how many months, and if you go for PLAB 2, you don't know how many months again. So at this stage, I think so until GMC only is thinking on what we should do and to deliver the best thing, because the number of candidates are skyrocketing. Last time I heard there are like 200 being given registration every week. So, and the exam is happening throughout the year. So you can imagine how many doctors are getting attracted to UK. And so until it's in the market, when we get some clarity at that stage, maybe we can have another session and we can talk what are the changes and what we can get as a IMG from India or anywhere, FMG, for example, in this regard.
So how is the cost, there? I mean, you're living there. What's the cost of living? What's the cost of things that you're eating? And also, obviously, I'm pretty sure you're in London. It must be a good environment to go out and, explore the place. So how is the cost aspect?
Yeah, so cost, practically it's a very big topic. Cost depends on the accommodation, commute, and daily expenses. Cost-wise, accommodation thing, I don't want to jinx myself, but I got a very beautiful studio at a very good price, and that is like 15 minutes from a hospital. So I'm living the dream now. Getting a studio in London is very nice thing. Secondly, about commute is cheap. Like commute is also, you can say, I'll try to answer this in regards to what the salary you get. For example, you get X salary. For example, you get 2,000 a month. For example, okay, you get obviously more than that, but 2,000 pounds a month. So you get a nice accommodation at 400-500. Maybe you can get it. Okay, I'm not saying about London specifically all the time, because London has this skyrocketing cost at sometimes about everything, and then commute is kind of cheaper as well. About the daily expenses, 40 रुपए किलो कांदा है यहाँ पे, ठीक है, और मैं बनाता हूँ ना, तो 49 रुपए, like 49 pence ₹49 का आलू लिया था मैंने कल, ठीक है। भिंडी ₹12 किलो नहीं है, ऑब्वियसली भिंडी महंगी है थोड़ी, बट थिंग्स आर अफोर्डेबल प्रैक्टिकली इफ यू कंपेयर इट विथ योर सैलरी। रोज तुम बाहर जाते नहीं हो, अगर तुम खुद का खाना बना रहे हो तो इट्स एक्चुअली वेरी चीपर। मैं कोई बोला था मुझे 150-200 pounds a month for all the groceries if you cook well. Eat out sometimes out, ऐसा मतलब eat sometimes out kind of, because you get maybe a 2,500-3,000 kind of salaries these days. So पैसा बच जाता है.
So you spoke about salary. अब मैं salary पे आती हूँ फिर. So what is the salary in the beginning as a residence person that I'm entering inside and working? क्या मिलती है salary and क्या वो बढ़ती जाती है आगे जैसे आप जाते हो? Or how does the exponential factor goes in this?
Yeah. So this is a taboo. Talking about salary is a taboo. People think it things. Practically मुझे अब तक पूरा salary मिला नहीं है, by the way. I've just started 3-4 weeks back. ठीक है. But the salary you get decent enough to get a good house to stay, comfortably commute, मतलब without any thinking of expenses. You can eat out almost every day, some KFCs kind of things, if you want to, or you can cook at home. And so I actually lost you on that question. So this is the general aspect. You get around 2,500-3,000 pounds. Yeah. The second point, every year you get this increments if you enter the training. So every year you get good specific increments because your scale increases. The scale depends on your seniority. For example, FY1 is an internship grade. FY2 is a senior to FY1 actually, and JCF FY2 are same level almost. So I don't have FY1, FY2. I am the junior most at my department. So the grades are good practically. Everybody lives comfortably with good money at the end of the month. It all depends on your expenses.
So if a student has a vision of going to US पर नहीं हो पाया US का और अब UK आ गए हैं, so now sitting in UK you're studying and you're doing your residency, but you still have the aim to go to US. So from UK while working there, can you give steps and probably go to US and work there later?
At this stage, you have to clear USMLE. Okay, so practically India, I have seen people who are like 3 years post graduation, 3 years of fellowships, 2 years of private practice, who are working at my level. Okay, who are working with me as a co-colleague, you can say that. So कितने भी 30 मार्क खा हो गए तुम लोग, फिर भी यहाँ पे आके you have to get the licensed exams for UK. Same works with USMLE as well. You get to have that license because they want you to be trained with their standards in the first place. मतलब this is the basic thing. This is licensed exam. This is not a residency exam PLAB. So for example, this example I always quote: you are applying for a driving license. The driving license doesn't guarantee you are driving a BMW or a Maruti 800. It just guarantees that you can drive a vehicle. It's on you what you can buy or you cannot. So this is the same for PLAB. I can say that. Yeah, there is no such direct criteria until you get a Nobel Prize or you're top of the 10 best surgeons in the world. Maybe then they can make an exception that please come and visit us, something like that.
Right. So you have to get to that level of proficiency to go there.
Yeah, you can give for fellowships, obviously. So this is different, but there are different pathways, different requirements. So this is not a very superficial kind of thing in this stage. Yeah.
Right. So since you are an IMG, I would actually like to know your views towards FMG, because a lot of war, a lot of comments, a lot of sayings from seniors or maybe juniors, keeps coming across कि अरे ये तो FMG है, मैं तो IMG हूँ, मैंने तो ज़्यादा पढ़ा होगा, मैंने तो यहाँ के सिस्टम के हिसाब से पढ़ा है, इनको तो कुछ नहीं आता. What is your perspective?
तो practically कौन से सिस्टम है? यहाँ पे तो सब शुरुआत से जीरो से शुरू कर रहे हैं ना.
सिस्टम एज इन जैसे अगर IMG हमारे दिमाग में भी ये करके इंस्टॉल्ड है.
Yeah, I know that. So that's what I'm trying to. I'm not. That was a rhetoric kind of question. In NHS, everybody is starting new. So IMG हो, FMG हो, there is no difference practically. किसी को कुछ नहीं पता है. सब चेहरे पे अंडा लेके आ रहे, कुछ पता नहीं है क्या हो रहा है, जिंदगी क्या चल रही है. Nobody knows anything about it. So, and if you are working consider in regard to UK, it doesn't matter. I have like FMG people with me as well who are my colleagues. It doesn't matter, and it's on how you take yourself from there rather than कहाँ से आए हो. People ask me about IMGs and all, for example, in India. So इंडिया में जैसे हम लोग को रहता था ना, गवर्नमेंट से पढ़ने वाला बच्चा और प्राइवेट से पढ़ने वाला बच्चा, राइट. यू कैन से दैट एफएमजी इज फॉर एग्जांपल गवर्नमेंट से पढ़ेगा या फिर ऐसा वाला काइंड ऑफ थिंग. आई थिंक सो, या. सो डजंट मैटर ना, अभी सब स्टेज पे ही है. अभी आई हैव क्लियर्ड ऑल दिस, आई एम वर्किंग नाउ. क्या फर्क पड़ता है, गवर्नमेंट से पढ़ लो, प्राइवेट से पढ़ लो. अभी गवर्नमेंट वाले भी पूछते हैं, प्राइवेट वाले भी पूछते हैं क्या करूँ वाला. सब वो स्क्वायर रूट बन जाता है, कितना भी नंबर बढ़ा लो स्क्वायर रूट में सब एक ही लेवल पे आ जाते हैं. Doesn't matter.
Everyone is at par at this point कि कहीं से भी.
हाँ. So until now it all depends on what kind of student you were more than being a FMG. So practically if you are a very bad student in FMG or in IMG, you will be bad throughout your career. Okay. If I was good in my private school, it doesn't matter whether I studied in a private school or government school, because I studied well in private school. That's fine for me. Yeah.
So let's talk a little about NEET PG, since अभी एग्जाम हुआ है, रिजल्ट्स आए हैं, कंसल्टेशंस चालू हो चुकी हैं. So how was your NEET PG and what would you advise the students to, कब पढ़ना चालू करो NEET PG के लिए, कब prep करो. NEET PG का भी, I mean, we're not sure NEET PG होगा, next होगा, क्या होगा. But exam है, licensing exam है, PG की seat चाहिए. So what's your strategy on NEET PG or next or whatever exam is going to come?
Yeah. So NEET PG this year, the cutoff went quite down actually. So it means the exam was not offer. All the very best for the counseling for whoever watching this. So when people think कि तू UK में बैठा है, तू क्यों दे रहा है ज्ञान NEET PG पे in the first place? So I gave NEET PG in the first attempt in the internship. Not going for NEET was not my criteria for going for PLAB. Okay. मुझे प्लैब जाना था इसलिए मैं प्लैब कर रहा हूँ. मुझे नीट नहीं जाना था इसलिए मैं प्लैब नहीं कर रहा हूँ. फर्स्ट प्लेस नीट पीजी. I joined dams and all classes. I had my handwritten notes which I didn't publish so because it's everywhere. So I actually, so for the people practically put in more hours. NEET PG demands hours from you. NEET PG doesn't demand CV from you in the first place. So वो बोलते हैं ना बहुत क्रूड और बहुत हार्श है. 8 महीना 8 घंटा डाल दो और देयर इज अ गुड चांस दैट यू कैन गो थ्रू नीट पीजी. बट लोग 1-2 साल भी लगते हैं. इट डजंट मीन दैट कि उनको कम आता है क्या आता है. सबकी अपनी पेस अलग होती है. सो मोर द MCQs व्हेन आई सो स्टडी फॉर नीट, द ओनली regret I have is I didn't do much MCQs. I feel I was good with the theory part from med school and good with this thing, but exam solving is a big aspect in it. I have seen many personal friends now who are good people, you're good students, but because they had that exam fear or kya hoga yaar maa baap kya bolenge nahi hua to types kind of thing, that exam pressure is very serious. So everyone who's watching this, kindly feel that more about the preparation. It's a big chunk is also depends on how you go through the exam process as well. So there's, ऐसा बोलते हैं ना, 3 hours decides. Actually this 3 hours only decides everything. एक साल तुमने कितना पढ़ा है वो तुमको 3 घंटे में कितना, when you can put in the income output ratio type of thing, input output ratio, that all matters a lot. So prepare, obviously prepare in the sense, firstly go through your notes. Secondly, go through as much as MCQs as you can, as much as, okay, just know your MCQs very well. And thirdly, give a number of mocks. So this is what I followed in MRCS. I gave a lot of mocks and a lot of MCQs. At one stage, this was a very bad thing because MRCS has some recalls. So people, when I used to read the first word in the question as well, I used to know which question it is. So in some aspect, because I knew what question it will be. So it's not a mugging up thing. It's about practicing and knowing what your boundaries are. So that is what I can say.
So many people say that अगर बाहर के एग्जाम दे दिए, जैसे यूके का एग्जाम दे दिया, यूएस का एग्जाम दे दिया, उसके लिए एक बार पढ़ लिया तो नीट पीजी तो ऐसे हो जाएगा. तो
कौन महापुरुष बोला है ये चीज? कौन बोला है
Obviously,
मुझे चरण छूने हैं उनके? No, this is highly wrong statement. Okay, to be blunt, mm, the approach is different in all the exams in the first place. Okay, medical knowledge is same, you can say that, but approach is different, depth is different. Consider this: personally, NEET PG was quite in depth as compared to PLABs, and not MRCS but PLABs. Yeah, PLAB is licensed exam. It's like a final year kind of thing. You can say that maybe. MRCS, yeah, in surgery, anatomy, MRCS was quite in depth. They needed surgical things. What you need for NEET PG. So practically for MRCS, I referred my NEET PG notes for surgery as well. But NEET PG needs you in quite depth. You have to know things well. You have to know them by your tip in the first place. If you,
right.
I can say other way around, because it stands true for me, because I studied well for NEET PG in the first place. I practically studied a lot for NEET PG. I can say that PLAB and MRCS were not impossible tasks for me after that. I already knew the things what they was telling me. I just wanted to know their approach. So this is the difference I needed to put in. But for the people who are starting from scratch, they need the medical knowledge, then the approach. I needed just the approach because NEET PG had taught me. Yeah. And by the way, I was getting surgery and DNBs and all in NEET PG. So for the people who feel that it's not possible to deviate from NEET or PLAB, it's not like that. If you feel it, just do it. It doesn't matter in longer terms.
Right. So let's talk about the social media aspect of being a doctor, also getting on social media, also trying to, be out there and talking to people. So how has this journey of social media, you've just started, or how is it, like, what's your input in this?
Practically, I started working on it now because I had some time with me. Until that time, my priorities were different. So until you have some credibility in life, people actually don't listen to you, is what I feel. So I feel that this is obviously not a statement what I can boast of, but practically people look up to credibility these days because information is in abundance. You Google PLAB, you get 10 things. I Googled PLAB for the first time to know the full form of PLAB. So this was my state. Secondly, about social media, one fine day working in a very beautiful government civil hospital, I was having a walk in the evening. I was like, क्या चल रहा है ये type. So I literally opened Instagram and I made an account which was firstly called as ePlab something kind of thing, because like यार किसको कुछ पता ही नहीं है, लोग मुझे सवाल पूछ, they didn't even pronounce the PLAB well as well. Flap, surgical flaps kind of thing, flap, random things, flap छोड़ के सब बोल देते थे. So I started in 2020 June this thing, but until March Feb 2022 I never worked on it. Now I feel it's my time to give back, and this is my time to tell people until now how I have been and how, because this is the difficult part I feel, but the catalyst in the reaction.
Right.
If you go through this, एक बार वो रहता है ना, चूहा बिल में घुस जाता है तो बाहर निकल जाता है कुछ ना कुछ करके टाइप्स. So this is my time I feel to give back. So 6 feet surgeon is one of that brainchilds of mine who obviously means that I'm 6 feet in the first place. And I'm 6 feet too, by the way. I'm boasting my height. And secondly, substantial help is what I feel is lacking in this niche a lot. There's a big vacuum for people who are getting substantial help, which I'm trying to bridge in now. So PLAB 1 के लिए क्या पढ़ूं, अरे कुछ भी पढ़ ले हो जाता है. This is what the guidance I sometimes got from people, which I hated as much as I can. When now people ask me PLAB 1 के लिए क्या पढ़ूं, I share them the Instagram link of PLAB 1 notes. This is you should read, you should study actually. So substantially you should help, I feel. And the whole aspect of 6 feet surgeon is to substantially bridge that lacuna that is there. PLAB 1 के लिए क्या पढ़ूं, तो ये notes है, ये पढ़, question bank कर, you will be in a good place. PLAB 2 के लिए I'll be coming with some things. MRCS के लिए I'm starting a teaching series for MRCS, क्या क्या करना चाहिए types. So this is my idea of social media.
Right. So your notes are digital or are they handwritten, and do you ship them? Do you send them as PDFs? वो कैसा होता है? आपने notes के बारे में बताते हो.
So they are both in both format, frankly, in a PDF. And yeah, so shipping is what I prefer. So I ship them to, I've shipped maybe 50 sometime copy, I don't know, I haven't had a count, but yeah, maybe 50 copy till now, to various places in India: northeast, south, Kerala, Tamil Nadu, north, uh, Bengal, बहुत जगह I've shared these notes, and I'm getting a very very nice feedback. When it's nice, people say that made the difference actually, your notes and your help. So it's not about getting my notes; it's about getting me on board. I feel, when you buy my notes, I know your name in the first place. When practically there are too much of messages these days, so when you buy my notes, I know that who the notes have been went through, because in the notes I write a personal message to everyone who gets them, on the basis of how you get it. I started this add-ons with it as well, that are online things. I get an image-based discussion, ECG-based discussion for the notes, uh, which is online, but the notes in general are hard copy. And firstly, I'll recommend you to go for the hard copy as well. See, practically for me to to sharing the access to PDF is easier, but I'm not a businessman, so I'm telling you personally, get the hard copy in the place. I will have to pay more for that practically, in terms of cost, but getting a hard copy, start reading every word of it. So what I can say crudely is, if you miss a single word of the notes, then you are actually less prepared at this stage. These are the bare minimum. This is the base of the pyramid. Uske baad medical knowledge is, add on your notes. I've specifically left some blank pages, left some that add your own notes, because obviously I don't boast them as complete notes anytime. They will help you to know what to study rather than how much to study. I feel that. So add your own notes, make a big 4 copies they are, by the way, because it's easy to use 4 copies. There are 1200 pages of exhaustive notes, you can imagine. Because I write little bit khula khula, so that's 1200. So that's all what you can go for PLAB 1 if you're starting. And frankly, you should try them, because 50 people who, and I can say that almost 98% people have passed who have went through the PLAB 1 notes till now.
That is great.
So yeah.
How can we sort of do we just text you, or do we have a form that we fill to get your notes? How do we reach out to you?
Yeah. So I have a form, but I'm available on text as well on Instagram. Just there's a post you can tag on it. There's a post for the notes thing. Just text me. I need a copy. I will share you the links that are needed. So practically I don't do these things now. There's machinery in place in India who prints it, who binds it, and ships it with all the things and all, and you get them at your home. घर के बाहर कोई हाथ में लाके देगा, टाइप्स काइंड ऑफ थिंग. दैट इज व्हाट माय एस्पिरेशन वाज. मुझे कोई तो भी आके बोलेगा कि क्या पढ़ना है, ये ले ये पढ़. सो this is the bridging kind of thing. So just DM me. I will share you some links which you have to go through once you have to get the copy. There's a Google form as well, but practically if you share me your address and your mobile number so that the postman can reach you, it's pretty simple. You are smart enough to clear MBBS. You're smart enough to buy notes as well.
Right. So you're starting a YouTube channel as well, right? So when is that? When is the inauguration happening, or when are you doing it, or is it already started?
No, so it is happening soon. So there's website development is in place as well. It's very too early to comment on that because I'm working on it. I'm not getting too much time these days, but now I feel I'm a little bit on the right track. So there will be there will be a blast of my first video, and I hope Laveena also shares it with and subscribe to my channel is what the norm is. I will obviously inform you guys, and Laveena will, if possible, she can also help share that thing when it comes. It will be coming soon. I'm working on what needs to be included in the first video actually at this stage, and the website development is under place. So fingers crossed. Until now, I am available on Instagram, so you can message me, DM me, anything, and I'm a little bit active these days with the stories and life kind of thing. Just pop into my life sometimes. I'll be happy to host you as well.
So we're coming to an end with the conversation. So lastly, I would actually like to ask, how has this whole journey from after 12th grade to abhi tak sitting in London, how has this been for you, for your family? I mean, are they unka aspect kya hai ki
Yeah,
हाँ अब settle हो गया है, like that?
yeah, yeah. So this is a very good question. I really wanted to talk on this. So firstly, I'll start it with there's a big quote which I have in my mind like permanent is we grow through what we go through. Okay. So this is a very beautiful line. So whatever I've gone through till now, I've developed myself in that aspect. So NEET PG ho gaya, PLAB 1, OET, PLAB 2, living in the UK, working at King's. So I have grown myself as a person because I've been went through all these changes. Okay, so the changes really feels what you can say a big thing for me as well. Keeping keep calm and start working kind of memes actually. So it feels really daunting sometimes that where I am, because 1 year back I was in sarkari chair with big fat belly of man ki kya ho kya types, big changes happening, and I'm working at a good hospital in London now. So it is really overwhelming for me, I can say that. And it is good to be overwhelming because you feel that you have done something and you're doing something good in the right direction. So to those all of the people who in whatever journey you are, to feel scared, to feel afraid, to feel lack of knowledge, and to feel overwhelming, it's very natural, and actually feel proud of if you are feeling any of it because you are on the right path. डर लगता है, ठीक है. I felt immense fear because मैं नीट पीजी पढ़ने लग गया था बीच में क्योंकि प्लैब 1 के सीट्स नहीं थे. डर लगना बहुत ऑब्वियस है, सबको लगता है. नहीं लगता है तो कोई तो भी दिक्कत है. स्ट्रेस आता है, माउथ अल्सर्स आते थे मुझे स्ट्रेस की वजह से. इट्स ऑल नॉर्मल, इट्स अ पार्ट ऑफ द जर्नी. एंड पेरेंट्स, बिग what I can say mention of them, practically to everyone who's watching it, I know how difficult it is to convince someone or convince your parents specifically to do something which you even don't know shit about. I don't know what's it in London to go to London in the first place, right? So it is difficult. मेरे पापा अभी भी मुझे ना कभी कभी, अरे तू नीट पीजी लगता नहीं, जो नीट पीजी दे देना चाहिए था. सो इट्स ऑब्वियस. मैंने बोला पापा अभी मैं काम कर रहा हूँ किंग्स में, नहीं चलेगा क्या? तो दे आर लाइक ठीक है, फिर भी तू नीट पीजी नहीं दिया ना, मतलब वापस. सो इट्स ऑब्वियस, हर घर में होता है, तो हर घर की कहानी होती है वो. व्हेन यू स्टार्ट अचीविंग थिंग्स, सो बैक इन 2020 माय पेरेंट्स हैड अ बिग डाउट कि ये क्या करेगा, सही में इसका कुछ खरा नहीं है, ये टाइम पास करेगा फिर रोते बैठेगा टाइप ऑफ थिंग, ठीक है. बट वंस आई गिव ओईटी, माय पेरेंट्स वर ठीक है, दे हैड दिस माइल्ड विंक इन देयर आई, कुछ तो भी दिया है इसने. देन व्हेन आई गिव प्लैब 1, तो हाँ ये कुछ तो भी दे रहा है प्लैब करके एग्जाम में काइंड ऑफ थिंग. दे डिडंट नो शिट अबाउट इट प्रैक्टिकली. देन व्हेन आई क्लियर्ड एमआरसीएस पार्ट, दे आर लाइक हाँ, घर वाले दे यूज्ड टू टेल रिलेटिव कुछ तो भी कर रहा है, एमआरसीएस कुछ तो भी रहता है टाइप ऑफ थिंग. प्लैब 2 दे दिया, फिर बोले यार सही में तो कुछ तो भी कर रहा है अभी. एंड व्हेन आई गॉट द जीएमसी रजिस्ट्रेशन, तू जा रहा है क्या? एंड व्हेन आई गॉट द जॉब, तो फिर तू सही में जा रहा है? तो so in these aspects I like to what my answer about the parents. When you clear things, they feel more confident. And practically one thing, you have to feel confident in yourself first. When I started in OET, I knew कि मैं कहीं ना कहीं पहुंचेगा अच्छे से, मतलब मैं 2 वक्त का खाना कमा लेगा मेरे नाम का टाइप्स. Practically that was my basic requirement. उसके ऊपर जो भी मिला, I feel honored to get all what I get. So feel confident about what you do. Nobody can tell you what you cannot do in the first place. Okay, nobody. कुछ नहीं होता है, प्राइवेट गवर्नमेंट सब ना बहाने होते हैं. Excuses sound best for the people who make them. So it's on that. And yeah, but if you can't convince your parents, I feel the reason is because you can't convince yourself. This is what I can take through. I convinced myself that I can go, and hence my parents had that what you can say भरोसा in me कि हाँ ये कर लेगा क्योंकि इसको पता है ये क्या कर रहा है. So कोई बोल रहा है इसलिए प्लैब मत दो प्लीज, ठीक है? मेरे को मैसेज ना करो अगर सर नीट पीजी नहीं हो रहा है प्लैब दे दो क्या टाइप्स, ऐसा ना करो, ठीक है? प्लैब देना है इसलिए प्लैब दो। नीट पीजी नहीं हो रहा है सेटिस्फैक्ट्री और तुमको लग रहा है यू नीड अ चेंज इन लाइफ, definitely DM me. I'm happy to get through all the questions. USMLE नहीं देना है इसलिए प्लैब दूं क्या, प्लीज मेरे को मैसेज मत करो. So be clear in what you want to do rather than doing कुछ तो भी कर लेंगे kind of thing, ठीक है?
Right.
I don't know, the big sort of ज्ञान प्रवचन, but I feel it's important for people out there. Yeah.
Absolutely. So it was a great conversation. I had a wonderful time talking to you, and I'm pretty sure our audiences too had that. So thank you, everyone. I'll meet you all next time with yet another guest and give you and enlighten your minds just like the way this conversation did today.
Yeah, so thank you so much, Laveena, for having me here and having sent 2 links till now. I hope the third one doesn't start. And sorry for if I don't reply to any of the DMs. I'm really sorry. There are many DMs who are waiting and who feel that I'm rude kind of person. Somebody said to my face as well. You don't reply to my face. You are so rude. So because I'm going through a lot of things in my life, मुझे खुद का पहले पैर जमाने दो फिर मैं तुमको हाथ दूंगा. But now I feel I'm on the right track. So I'm happy to get your questions. PLAB notes, just drop me a text. I'll be happy. And stay tuned for something coming big kind of thing. And whenever it comes big, do support, because what I need is it has to reach many people so that I can diversify on that aspect.
Yeah.
And
Thanks.
yeah, thank you so much. Yeah.